Hello. Today we're here to talk to you about osteoarthritis. Osteoarthritis is an inflammatory degenerative disease of articular cartilage in synovial joints, such as weight-bearing joints of the knee, the hip, and the spine, and the small joints of the hands and the feet. It is the most common form of arthritis. It is caused by the breakdown of cartilage over time due to damaging pro-inflammatory mediators such as interleukin-1, interleukin-6, and tumor necrosis factor. It is also caused by mechanical and oxidative stress. This wearing down of articular cartilage is also due to compromised function of chondrocyte cells. Normally, chondrocytes maintain balance between breakdown and buildup of cartilage. In osteoarthritis, the previously mentioned pro-inflammatory mediators, mechanical and oxidative stress, compromise the function of chondrocytes and cause them to undergo early deterioration, thus tipping the balance to increased breakdown of cartilage. Cartilage deterioration causes bone hardening and grading, narrowing of the joint space, bone spurs, also known as osteophytes, along the bone's edges, and bones rubbing together in severe cases. Risk factors for developing osteoarthritis include aging, joint injury, mechanical stress, obesity, genetics, inflammation, and drug use. The signs and symptoms of osteoarthritis include pain, especially with activity, morning stiffness, which typically subsides after 30 minutes, crepitus and grating, restricted range of motion, Heberden's and Bouchard's nodes, and joint deformity. The diagnosis of osteoarthritis is not limited to one simple test. It consists of many factors, including patient history, physical examination for redness, tenderness, swelling, and range of motion, imaging such as X-ray to show narrowing of the joint and the bone spurs, and MRI to show cartilage degradation. Lab tests such as blood work to rule out other disorders and synovial fluid analysis are also conducted. Nursing management includes assessing the patient's signs and symptoms, their pain, their perception of the disease, and how their activities of daily living are being affected. The nurse should also provide patient teaching on sign and symptom management through lifestyle changes such as low-impact exercise, range of motion, and strength training. The nurse should also provide information about physical and occupational therapy and non-pharmacological pain management, such as hot and cold compress, weight loss, and assistive devices. Treatments for osteoarthritis begin with medication. Medication includes acetaminophen, which is an analgesic that inhibits the enzyme COX-2 in the central nervous system, or CNS. This inhibition inhibits the formation of prostaglandins and thus inhibits pain and inflammation. Celecoxib is another drug that works by the same mechanism, however, it is not limited to the CNS. Both of these drugs cause GI irritation and liver and renal toxicity. Celecoxib also causes cardiovascular effects such as chest pain. Intra-articular injections are also available. These include sodium hyaluronate for joint lubrication and corticosteroids to decrease inflammation and pain. However, corticosteroids are limited to 3 to 4 injections per year due to the negative long-term effects they can have on the joint. Glucosamine and chondroitin are natural therapies that are building blocks of cartilage and have been shown to decrease signs and symptoms and improve cartilage health. Lastly, surgery can be used to remove debris in the joint, realign the bones, and in severe cases, complete a total joint replacement. Unfortunately, there is no cure for osteoarthritis, and it escalates over time. This leads to poor prognosis, and patients often acquire disability. However, quality of life can be maintained through lifestyle changes and pain management and support. Thanks for watching.